Now, what about human rights legislation? We have several landmark legislations. We have the ADA in the United States, we have the DDA, we have the Equality Act in Scotland. But I think one of the most fundamental changes is the UN Convention on the Rights of Persons with Disabilities. So, Article 25, and I sent this around, so I'm just reading it out. This is a mandatory binding document. The UK has signed this. State parties recognize that persons with disabilities have the right to the enjoyment of the highest attainable standard of health without discrimination on the basis of disability. States parties shall take all appropriate measures to ensure access for persons with disabilities to health services that are gender sensitive, including health-related rehabilitation. In particular, states parties shall provide persons with disabilities with the same range, quality and standard of free or affordable healthcare and programs as provided to other persons, including in the area of sexual and reproductive health and population-based public health programs. Now let that sink in for a little while, and I can send this actually around so you can look at it as well. Just wonder how well we are doing to fulfill the legal mandate that we're having to do this. So I'll leave that in the room for a while as we move on with the talk. Paul, can you just hold up your card? What does it say?
15 to 20% or 1 billion.
Okay, that's good. That's a lot. So that's that's a WHO estimate of the worldwide population of people with disabilities, depending on how you count them. And there were problems, we're running into problems again. But that's an estimate that we have. So 1 in 5 people have a disability or are considered having a disability. So that's quite substantial. It's the largest minority that we're dealing with. Now, what are the problems with that number? Obviously, there's a problem with the definition, how we're defining disability. There's a problem how we collect data, in various countries, which resources we put behind data collection, who is included in the data collection process, who is counted, who can participate. Are people in care homes included? Are we just looking at household surveys? Are we just looking at regional surveys? What training do we have to include people who cannot read? People who have visual impairments? Do they have alternative formats to collect this data from them? People who have intellectual disabilities or learning disabilities and difficulties. How do we count this group to be inclusive? And what are the purposes behind the data collection? Whether we're looking at labor market statistics, it might be a slightly different estimate of people who are disabled compared to social benefit statistics or general health statistics. So there's a lot of work to do in that area, and I'm hoping actually to be participating in an exercise by the United Nations very shortly to inform global disability statistics development. So I'm working to hear about that in the near future. So I think what's essential is to get the people's voice in healthcare decision making, but also in the research that's underpinning healthcare decision making. Both in the population health monitoring that we're doing, but also in terms of research interventions. So can I just ask now John to get his card and to read out what we have there.
Patients were excluded if they 1. were not returning to their GPs for management, 2. were discharged to a nursing home, 3. had serious comorbidities, 4. were non-English speaking, 5. died while in hospital, 6. were too cognitively impaired, 7. were notably aphasic, or 8. lived more than 2 hours away by car, or 9. suffered subarachnoid hemorrhage or subdural hematoma. Other reasons for non-participation included the family declining to take part involvement in another research program, and not being assessed prior to discharge.
Doesn't that make you wonder who's included in that trial or in that study? And that's a community-based study. That's not even a drug trial. So 1 in 5 has a disability. You have that list on top of that. So that leaves questions about intervention studies. How safe are they? How effective are they if they're not inclusive? What is the evidence base that we actually have, for people with disabilities in terms of health-related interventions? How good is it? Who asked these questions? So I like to ask these questions, and I like to ask questions how we include people in data collection, and how we adapt the measures, not how we exclude people if they cannot interact with the measures, but how we actually make the measures as inclusive as possible.